Okay, so the first test I'll be doing today is the Valgus stress test. So this test will be stretching the UCL ligament of the elbow, and to perform it, we'll put the arm in full extension here. Apply a force with this right hand here, lateral to medial, and then with my left hand I'll be pushing medial to lateral right there, and then you can bend it a little to test different portions of the UCL ligament. And then positive will be pain or discomfort. The bear is stress test, and I'll just be doing the opposite of what I just did. So switch the hand positioning and then apply the forces in the opposite direction. And you can bend the arm a little bit and do the same thing there. Any pain with that? No. Good. Alright, the next test we'll be doing is the Cozens Test, which will be a test for lateral epicondylitis. It'll be an active test, specifically testing the strength of ECRB. So what we'll do is we'll extend the elbow fully, pronate the forearm, and then extend the wrist and radially deviate it. And I'll be applying a force, pulling in an ulnar deviation and flexion of the wrist while I'm palpating the lateral epicondyle with my left hand here. Ready? Hold, hold, hold. Any pain with that? Okay. A positive test would be pain at the lateral epicondyle. And the next test we'll be doing is the Mills test, which is a passive test that'll be stretching the extensor muscles in the lateral epicondyle. This also tests for lateral epicondylitis. So we'll be extending the elbow here, pronating the wrist, and then we'll be flexing the wrist, or pronating the forearm, flexing the wrist, and then ulnarly deviating the wrist to get a stretch, maximum stretch. And pain would be at the lateral epicondyle here again. Feels positive. Do you have any pain with that, Evan? Alright. That'll be a negative Mills test. Alright, the next test we'll be doing is the third finger resistance test. This will be testing for lateral epicondylitis, but more emphasis on the extensor digitorum muscle. So for this one, I'll be palpating around the lateral epicondyle, finding the extensor digitorum muscle, and then we'll extend the third digit, and I'll just be applying a force, and he'll be resisting. So don't let me move your finger here. Hold, 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 hold. Any pain with that? Positive will be pain. And then the next test we'll be doing is the medial epicondylitis test, and this is a passive stretch on the flexor muscles that attach at the medial epicondyle. So what we'll do here, I'll just walk Evan through it. We'll be extending the elbow, supinating the wrist, or supinating the forearm, extending the wrist, and then radially deviating. Do you feel any pain with that? And pain would be found at the medial epicondyle, and that'd be a positive medial epicondylitis test. Okay. The next test we'll be doing is the posterior lateral rotary instability test. And for this one, we'll be putting stress on the lateral ulnar collateral ligament part of the lateral collateral ligament complex. A lot of laterals. And for this, I'll flex the patient's shoulder at about 130 degrees. I'll apply an axial load through the elbow while fully supinating the wrist. And then I'll apply a valgus stress at the elbow as well. Okay, any pain with that, Evan? No. A positive sign for that would be pain. The next test I'll be doing is the moving valgus stress test, and for this I'll need the patient seated, and I'll abduct the arm to 90 degrees while fully flexing the elbow. And for this, I'll just be applying a valgus stress to the elbow while extending the elbow as well. So I'm applying the valgus stress, and then now I'm just going to extend the elbow. Any pain with that? No. Positive sign would be pain. Alright, the next test we'll be doing is the upper limb tension test 1, which would be putting tension on the median nerve. So what I'm going to do here is I'm going to depress the scapula abduct the arm, and then we're going to start in a flexed elbow and an extended wrist position, and we'll just extend it right there. And if you want it to feel it even more, you can turn his head to the left and side bend as well to that side. And then the next test we'll be doing is upper limb tension test 4, which is the ulnar nerve. So we'll just do the opposite. So then we'll flex the elbow here and keep the wrist extended to put tension on the ulnar nerve. Alright, so the next test we'll be doing is upper limb tension test 2, and this one is also the median nerve. So the difference here is we'll have the arm abducted to 30 degrees, and this also stresses the musculocutaneous and the axillary nerve as well. So what we'll do is we'll start here with the wrist and the fingers extended. We'll go down and also externally rotate the arm while depressing the scapula. You should feel some tension there. And then the next tension test we'll be doing is to stretch the radial nerve. So the arm abducted to 90 degrees again. Press the scapula. This time we'll flex. We'll flex the wrist and we'll extend it all while also ulnarly deviating the wrist. Feel a stretch there. You can turn his head there again, just like for the rest of these tension tests. Okay, the next test we'll be doing is Wartenberg sign, and this will be testing the ulnar nerve. And so what I'll ask Evan to do here is start with his hand on his knee, abduct all his fingers, and then just try to adduct them. Touch them all together. And a positive sign would be having the 5th digit stay abducted. And the next test we'll be doing is the elbow flexion test. So what I'll have Evan do here is flex his elbows, extend the wrist like this, and then just hold it here for 2 to 3 minutes. And a positive test would be discomfort or tenderness or numbness and tingling down the ulnar distribution through the arm and wrist. And then the final test we'll be doing here is the pinch grip test. And so this tests the anterior interosseous branch of the median nerve. And so what I'll ask Evan to do is try to touch the tips of his index finger and his thumb together while having it make like a circle there instead of being a pad-to-pad approximation. Okay, so the next test we'll be doing is Pronators syndrome test. And for this one, I'll have Evan start with his elbow flexed here and forearm pronated. And what I'll be doing is I'll be trying to push him into supination as I extend his elbow, but he'll be resisting the supination. So we'll do this on the count of 3. I'll be pushing into supination and extending the elbow. So 1, 2, 3, hold it, hold it, hold it, hold it. Okay, any pain with that? No. All right, and so the next test we'll be doing is Tinel's sign. And so I'll just palpate between the medial epicondyle and the olecranon. And just proximal to that, I'll just be tapping to try to reproduce the ulnar nerve symptoms. Okay, any pain with that?